Orthotics. 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 Why do I keep saying orthotics? Because it's simple. Orthotics are the gold standard to fix the majority of the biomechanical issues my patients have. What is the major difference between the custom orthotics that we make here at Absolute Foot Care Specialists and the devices you can purchase over the counter at Walgreens or Walmart? It's basically really simple. The over-the-counter devices are just cushions with an arch support. Our custom orthotics take into consideration the biomechanics of each and every patient. We post the rear foot, correct for the midfoot, and post for the forefoot. You can come to Absolute Foot Care Specialists where we will custom make an orthotic for you. When we say custom, we mean starting from scratch. Not custom fitted, but custom fabricated. We're going to be casting Daniel for orthotics today. We use a material called biofoam, which is an impression foam, in order to capture what we call the negative. And the negative in a prescription is sent to the laboratory to fabricate Daniel's custom orthotics. So when we take the impression, we do what's called the Taylor tilt method. So what I do is I pinch Daniel's ankle. I'm just going to bring you out here a little bit. Put him into his neutral position. Put pressure on his knee, taking the rear foot. Then I capture the forefoot, holding his foot in neutral position, and take the impression. Let me lift that up, and there's one foot. So here we are off to the orthotic lab. The negative is being received by the pedorthotist, and the pedorthotist takes the negative impression to create a positive, filling it with plaster of Paris. Once we have the plaster of Paris dried, it is relatively like having the patient's foot in the lab. And here we are at the first step of the custom creation of the orthotic, where we take the space age plastics and vacuum seal them. Once the plastic hardens, we go on to the next phase of creation. And here we have the stages of the fabrication of the orthotic till we have the final product, which is then shipped off to our practice and dispensed to our patients. Daniel's orthotics are in, so come on in, we'll get them fitted. So we have custom-made orthotics, and because they are custom-made and handcrafted, we want to make sure that the prescription that I wrote to correct Daniel's biomechanical abnormalities is correct. So we do a simple fitting. Like a glove. Perfect. All right, now Daniel has the orthotics in his shoes, and we're going to watch his new gait pattern. So let's have you head on down toward the cabins. Walk as normally as you possibly can. And that's the story of orthotics. So by now it should be obvious the significant difference between purchasing a custom-made orthotic and something that you pull out of the box at the drugstore or something that is dispensed over the counter.